about that. So misoprostol is the prostaglandin that is approved for use as a protective agent when somebody might be taking NSAIDs chronically. So if they can't not take NSAIDs in the case of rheumatoid arthritis, they would be on a protective agent such as misoprostol. So prostaglandins as a class also produce contraction, specifically in women of the uterus. So if somebody is pregnant, that could cause spontaneous abortion. Whenever somebody is on misoprostol, it is considered category X, which means do not take during pregnancy. And they are warned very well against this side effect. So we make sure that these women know if they're of childbearing age, should they become pregnant, they will most likely not be able to sustain that pregnancy if they stay on this medication. Our next class of medication is proton pump inhibitors. These directly inhibit the exchange of hydrogen ions. So hydrochloric acid is made up of H and Cl, or hydrogen and chloride. So if we are directly inhibiting the exchange of hydrogen ions, we are preventing the combination of the two to make hydrochloric acid. So these are approved for short-term treatment of benign gastric ulcers, active duodenal ulcers, GERD, or long-term therapy of hypersecretory conditions. In this case, we're talking about the drugs Nexium, Prilosec, Prevacid. Those are all brand names. Generic names you might hear include lansoprazole, omeprazole, rabeprazole, and again, these should sound pretty similar to each other, so you'll be able to recognize the class that way. They are used in treatment of H. pylori as well as part of a combination therapy. And moving on, and I'm following right along with the slides that are linked on to Sakai, so you guys can move along with me. It's page, we're now on anti-secretory drugs, gastrointestinal stimulants. These induce contractions of the upper GI tract to prevent reflux, and they keep damaging stomach contents from reaching the esophagus. Specifically, we're talking about metoclopramide. It increases tissue sensitivity to acetylcholine, and it works on GI smooth muscle to kind of move things along out of the stomach and into the small intestine to prevent the contents of the stomach from backing up into the esophagus and irritating it. Metoclopramide works best at reducing daytime food-induced heartburn, and it's used before meals, usually. For GERD, they will give an additional dose at bedtime. Adverse effects of metoclopramide include restlessness, drowsiness, diarrhea, and headache. And next, we're moving right along to anticholinergics and antispasmodic drugs. Anticholinergics block muscarinic receptors, which directly decrease gastric acid secretion and intestinal motility, whereas antispasmodics are used to just decrease intestinal motility. So our adverse effects are usually related to so anticholinergics as a class have what's called class effects, and these are CNS side effects, blurred vision, urinary retention, constipation, and drowsiness or fatigue. So that's pretty common for all anticholinergics. So if you're told that a patient is going to be getting an anticholinergic, that's what you're going to be on the lookout for. Drug interactions of these medications include cardiac glycosides, antipsychotics, and tricyclic antidepressants. So, moving on to acid neutralizing antacids. They're exactly what they sound like. They cut down on the amount of acid that's in the stomach. They neutralize it by reacting with hydrochloric acid. They're indicated for relieving pain and indigestion of overeating, GERD, hiatal hernias, and peptic ulcers. And hiatal hernias can kind of protrude into the stomach, which is why they cause problems. They're taking up space and pushing things up where they shouldn't be. Most antacids are non-systemic, and they work directly on the stomach, so they're more local. And their use should be limited for reasons that you can read about under that section on page 555 to 556. Antacids can go, usually antacids are combined, aluminum with magnesium. Aluminum causes constipation, magnesium causes diarrhea, so when we combine the two, they kind of cancel each other out. However, other antacids, such as calcium carbonate, can cause constipation, so that's a side effect that we'll be looking for there. Adverse effects as a whole, hypophosphatemia, which means decrease, especially with aluminum compounds, a decrease in the amount of phosphate in the body. Hypercalcemia, especially with calcium carbonate antacids. And acid rebound, which is where the body can sense that its gastric pH is not high or low enough, so it'll keep increasing the amount of acid it's making, thereby sort of counteracting the amount of drug that we're giving. A lot of the antacids can alter the absorption and excretion of other drugs, especially an antibiotic called tetracycline. We try to separate tetracycline-like compounds. We try to separate out administration by a couple hours on either side to give the medication time to work. Our last medication that we're going to cover, I'm sorry, I think I said antacids were covered on 555 to 556, but they're actually 553 to 555. 555 to 556 discusses sucralfate, and it's kind of a cool drug. It is aluminum, it's a complex of aluminum hydroxide and sulfated sucrose. And what you do is when you take it, it actually performs a protective barrier all around the stomach. So it's non-systemic, it's more of a local action on the GI system. However, it doesn't alter pH. So instead, like I said, it creates that protective barrier, so it can also prevent the absorption of some medications, so it also has to be separated by medications, usually given on an empty stomach, taken 4 times a day, 1 hour before meals, and at bedtime. Antacids can also be included as part of therapy with sucralfate. However, they have to be separated and shouldn't be taken within 30 minutes before or after. So you can kind of see that might be hard for a lot of people, is taking this medication 4 times a day. They have to separate out all their meds or figure out what to take first and then when to eat. So as you can see, it could be a little bit of a complication for those patients. Last but not least, management of emesis, which is vomiting. We can sometimes be trying to make someone vomit, or we can be trying, more often than not, we're trying to prevent it. When we're trying to make someone vomit, it's because they've swallowed something that could be poisonous to them. Again, I'm not going to cover the sort of background on vomiting. You can read that and kind of take that all in yourself. We're going to start on page 558 with emetics. So the most common one they talk about is Ipecac syrup. It's kind of gone out of style now that we have other methods of retrieving things that people have swallowed, such as, you know, activated charcoal, gastric lavage, etc. Syrup of Ipecac has kind of gone by the wayside. However, some people do still keep it in their house and they do still use it. So usually they give, you give a dose or 2 doses, and if vomiting hasn't occurred within 15 to 30 minutes, you usually take a patient to a hospital to get them to have their stomach pumped or to use activated charcoal. It's a pretty scary drug because if it's not given correctly, it can actually cause more problems than it helps with. Specifically, if the patient aspirates it into their lungs, they can end up with pulmonary edema, which is water entering into the lungs, as well as pneumonia. So syrup of Ipecac should never be administered to individuals who are unconscious, semi-conscious, or severely inebriated, or who are having seizures. It's contraindicated in several situations, such as when the ingested substance is unknown or caustic, such as lye, or is petroleum-based, such as kerosene or gasoline. It's available over the counter, and a lot of people do, again, keep it in their house. Last but not least, antiemetics. Serotonin, 5-HT3, and NK1 receptor antagonists. So, serotonin antagonists are among the newest drugs that prevent or reduce nausea and vomiting brought on by cancer, or cancer chemotherapy is what they originally used for, radiation therapy, and post-operatively as well. These drugs include ondansetron, granisetron, and dolasetron, and palonosetron. Again, they sound similar to each other, so just keep that in mind. They prevent nausea and vomiting by preventing serotonin from initiating signals to the central nervous system, and basically they're kind of standing in the way of that signal that's going back to the brain saying, hey, we don't like this, go ahead and throw up. That's the simplest way of putting it. They also block serotonin stimulation in the CTZ, the chemo trigger zone, as well as the vomiting center. So again, they're just blocking those signals to let the brain know that it's time to vomit. There's no major differences in effectiveness between the 3 first-generation ones, dolasetron, granisetron, and ondansetron. These drugs are more effective. They're usually given in combination, especially in chemotherapy, they're usually given in combination with other medications. We really want to make these patients comfortable, so we try to give them a couple different antiemetics to help them out. So, they're available oral and intravenous, and they're metabolized in the liver and excreted by the kidney. They're usually pretty well tolerated, the biggest side effect being diarrhea, constipation, dizziness, headache, fatigue, sleepiness, etc. So, on to NK1 antagonists. The only one that I'll talk about here, I think there is only one right now, is aprepitant, or fosaprepitant, which is the intravenous form. And it is the first in a drug class called NK1 receptor antagonist. So I'm going to go right through what the book says because this is the simplest way to explain it. Endogenous substance P is an important neuropeptide in neural transmission that binds and activates NK1 receptors. Substance P is associated with nerves that respond to painful stimuli as well as regulation of mood and vomiting. It's found in high concentration in the brainstem, along with other neurotransmitters such as dopamine, serotonin, and opioids. No matter what the emetic stimulus is, substance P and its NK1 receptors are the final pathway that regulates vomiting. So if we cut this off, then we have cut off the pathway that is going to tell us to vomit. So aprepitant has a high affinity for the receptor that substance P binds to, the NK1 receptor, so it blocks substance P from binding to it. It is available as oral or intravenous. It's metabolized primarily by CYP3A4, which is one of those hepatic metabolism enzymes that we talked about. And it's, again, usually combined with other medications such as the serotonin HT3 receptor antagonists or dexamethasone when given for chemo anti-emesis. They talk a little bit about Emetrol, which is phosphorylated carbohydrate solution. This is the one that is safe for pregnancy. So women, it's available over the counter, and women can take it freely without worrying about any problems they might have. It's safe to take. I'm guessing it'd be category A if I looked it up. Off the top of my head, I'm not sure though. So you'll see that mentioned a little bit. It's not safe for use in diabetics because it is a sugar solution. It will kick their sugar right up. So keep that in mind. They also talk about dronabinol, which is essentially marijuana without all the stuff that you put in it to smoke it. It's basically THC, and it's used a lot for cancer patients who are having trouble with appetite. It kind of has a lot of actions within that part of the body, but it can also control nausea and vomiting, which allows these patients to eat. So, let's see. Skipped a few slides there because I stopped looking at them. Emetrol, dronabinol, indicated for treating nausea. Let's stop there. It's pretty much the end of the chapter, and we're getting close to the cutoff time that YouTube allows for videos. If you guys have any questions, please feel free to email me. Every chapter on this specific, or any week really, every chapter will have 5 questions on the test, usually 2 easy, 1 or 2 medium, and 1 or 2 hard ones for a total of 5 questions per chapter. They can always be found right in your book. The questions are pulled directly from the book, so anytime you're taking these tests or doing the homework, make sure you're looking in your book for the answers. Become familiar with what pages discuss what. That'll help you save some time on the tests. And again, as always, any questions, please email me. I'll be posting this shortly. I'm moving on to chapter 34. And I think that's about it for now. We'll be covering 34, 35, 36, and a couple more chapters after that. Again, this is kind of a big week, but take your time, go through it chapter by chapter, and let me know if you guys have any questions. Thanks.